Hi everyone, this is Michael Uriarty or Dr. Mike, and today we are going to talk about the Myokinesthetic System, of course, and Erik Dalton's Myoskeletal Alignment Technique. So I'm going to have Albert and Irene helping me out, my AI counterparts, and I will have to pause the audio and correct a few things as they're talking through. But right now I'm kind of enjoying this. So we're going to get into this and find out some similarities and differences between these two techniques. Let's dive in.
Deep dive. This time we're imagining you're at a crossroads trying to decide between two pretty promising paths to, take your practice to the next level.
Okay.
You're looking at continuing education, right? And there are two big names that keep popping up. MyoKinesthetic System, that's MYK for short.
All right.
And then there's Myoskeletal Alignment Techniques, or AT. Mm-hmm. They both...
Okay, so every now and then they mess up and they don't say MAT, which is MAT. They say either AT, or sometimes they throw in some other things. So I'm only going to correct it this once, but you'll get the gist when they go through it, and sometimes they don't always say MAT, but that's the abbreviation for his technique. Okay.
Give you the tools to deal with pain and get people moving better.
Right.
But they use different approaches to get there. So we're diving into their websites today
Cool.
to try to help you figure out which path really aligns with your goals.
It's like choosing between two different trails to get to the same mountain peak. Right?
Exactly. Same destination.
But the scenery along the way is going to be completely different.
Yeah. So we're here to kind of like scout out those trails before you actually, put on your boots and start hiking.
Perfect. Love that.
First things first, accessibility. It looks like both MYK and MAT, they get it. Practitioners are busy.
Oh.
So they both offer online and in-person formats, which is awesome.
Yeah, I mean, that flexibility is just key for reaching more people, right?
Right.
Especially people who are maybe in more remote areas.
Exactly.
Or they just have really demanding schedules.
But MYK actually goes a step further.
Yeah.
They've got live webinars built into their online courses.
Oh, wow.
Okay, so it's not built into the online course. So basically there's 3 ways to get CEUs with our class or to learn the technique. One is an in-person class. We'll actually come to your office, so that's one. The other is an on-demand home study course, which is available 24/7. You can access that whenever you want. And then the other is a live webinar. We do it over the internet through Zoom. And this is just like an in-person class, and it's set up exactly like the in-person class, except we do it over the internet. So 3 different ways, not built in to the other. Okay.
So it's a little bit more real-time interaction.
So it's like bridging that gap between online learning and actually being in the classroom.
Yeah, exactly.
I like that, especially for practitioners who are newer to this and maybe need that interaction.
Yeah, absolutely. Mm-hmm. Now let's talk about institutional recognition, because it's always interesting to see where these programs kind of stand in the academic world.
Sure.
MAT has a pretty impressive partnership with Indiana State University.
Wow.
They've teamed up to create a massage minor that uses MAP principles.
So it's a sign of legitimacy.
Yeah.
That's huge.
Yeah, it adds some prestige. But MYK has a different kind of street cred. Their founder, Dr. Uriarty, he's an adjunct instructor at University of Idaho.
Uh-huh.
And she's been busy building up research behind MYK's methods. Like, we're talking 6 peer-reviewed articles that have already been published.
Wow.
And 4 more are being reviewed right now.
So they're not messing around. They're serious about the science.
They're not just relying on testimonials. They're really going for that scientific validation.
And for some people, that's really important to know that the research is there.
Totally. All right, let's get down to the CEUs.
Okay, yeah.
Continuing education units.
Important.
Both MYK and MAT offer them. We all know how crucial those are.
Yes.
For your license, showing that you're staying up to date.
Absolutely.
But there's a little difference here.
What's that?
MAT highlights CEUs for massage therapists.
Okay.
While MYK, they're offering credits for a bunch of different professions.
Oh, interesting. So maybe MYK techniques can be used beyond just massage therapy.
Right. Or maybe they're attracting a more diverse group of practitioners.
Yeah, like PTs, chiropractors, maybe even osteopaths.
It makes you wonder what kind of community you'd be joining, right?
Okay, so I can tell you what kind of community. So no osteopaths, not yet. So, but we do have physical therapists and physical therapist assistants, occupational therapists and occupational therapist assistants, athletic trainers, massage therapists, chiropractors. Those are the 5 top professions that we teach. We've dabbled with nurses and some other professions as well, but those are the top 5. Okay, here we go.
Now let's get into the heart of it. Their treatment approaches.
All right.
MYK really pushes their posture chart.
Oh, okay.
It's like their roadmap to guide these targeted treatments for the nervous system.
I see.
They even say most treatments only take 15 minutes.
Wow. So efficiency is a big thing for them.
It seems like a big part of their philosophy.
Yeah, you've got to wonder what that looks like in practice, you know?
Yeah.
Like having a visual tool to help you figure out those nerve connections.
Right.
So you can get to the root of the problem quickly.
Right.
That's a big claim.
Now,
so that's important because the assessment part of it is pretty important. If we can get on the right nerve level, we can eliminate physical pain and we can restore function almost immediately. And so the posture chart, basically it's like a checklist. You just look at somebody and say that's off, that's off, that's off, and then you can calculate it up to find the exact nerve problem that person is having, and then we treat everything on both sides, and they stand up and they go, whoa, I feel better. And depending on the nerve level that we're treating, so if somebody comes in with headaches, those are like 3-minute treatments. If somebody comes in with shoulder pain, that's more like a 10-minute treatment. If somebody comes in with like plantar fasciitis, that's like a 15-minute treatment. So depending on the nerve level that we're treating or for the condition that we're treating, depends on how long the treatment actually takes. Okay.
they describe their approach as brain-based.
Oh, that's intriguing.
It sounds interesting, but also like, what does that even mean?
Right. It raises a lot of questions.
Yeah.
Like, are they bringing in neurology or psychology into what they do? You know, are they looking at pain and how we move through like a neurological lens?
Yeah.
That could be a big deal for practitioners who want a more holistic approach. Right?
So from my understanding, Erik does not teach that. Erik does not get in, from my understanding, and I've talked to Erik a number of times. He's a very cool guy from the business side of it. You know, the two of us being in the same profession, and so getting to know him and everything. He was a pretty cool guy. So, but my understanding is he does not get into that kind of stuff with his technique. It's more the movements. It's more how to treat individual muscles and things like that. But he doesn't get into the nervous system per se, real in depth, I should say.
Really sets the stage for the next part of our deep dive. We've got the basics down.
Yeah.
But now we need to really get into these different approaches.
Dig a little deeper.
Yeah. And see what makes each one unique.
It's like we've reached the trailhead and now the real adventure begins.
Yeah.
I'm excited.
Me too. So we've got these two trails, right? We've got MYK over here, all about efficiency and targeted nervous system treatments. And then there's Matt over there with that brain-based approach that has us curious. So where do we even begin?
Well, I think it's time to break out the map and look a little closer.
Okay.
The websites give us a ton of info, but it's like we need to read between the lines.
So we're talking about the culture.
Yeah.
Like the values and the philosophy behind each one.
Exactly. Look at the words they use, the pictures they choose, the stories they tell. It all adds up to a certain identity, like a feeling of belonging for the people who are drawn to that method.
Yeah, I see what you mean. MYK seems to be super structured, like systematic.
Right.
Their website's got all these detailed descriptions, lots of numbers too.
Oh, yeah. Like what?
Well, they're talking about like the 84 muscles in their upper body course,
Right.
or the 29 nerve pathways they work on in the lower body series.
So it's like they're speaking to the analytical mind, right?
Right.
Someone who loves a clear roadmap, step-by-step instructions.
Yeah, and it all ties back into that efficiency thing.
Right.
It's not just about the treatment being quick, but also learning it quickly too.
Yeah. Like they've streamlined the whole learning process. Okay, but then you've got Matt.
Before he jumps into that, so with our technique, yes, we get into that kind of information. We don't get bogged down into that kind of information. So the thing that I like to do is I like to take some of the bigger words and some of the more complicated information, and I always bring it back down into layman's terms. So that's kind of how I teach. I teach more from just a conversational standpoint instead of getting real in depth and using, all the big words and stuff that you can get with anatomy and physiology and all that. I bring everything back so that pretty much everybody can understand, what we're doing, why we're doing it, and that kind of stuff. Okay.
Different.
Yeah.
Their language is more conceptual,
More about the why.
Yeah, exactly. Like the why behind how the body works. If they talk about rebalancing the body, re-educating the client, restoring function from, of course, that brain-based perspective, it's almost poetic,
It's true. They're asked.
Which is kind of funny because I was looking at some of his information, and one of the things that we say our mission is to eliminate physical pain and to restore function, to get movement back, and then bring in just total health, getting people back to just overall health. And so we say kind of the same thing. So we say we're going after kind of the same stuff, but we're definitely doing it from two different standpoints, two different angles here.
Think about the body in a new way. Like this whole interconnected system with the brain as the control center.
Yeah, and that might resonate more with a practitioner who's into that holistic approach,
Right, they want to understand the whole picture.
Yeah, the why behind the what.
So it's like these programs attract different types of people, different learners.
Right.
Almost like different personalities.
Different philosophies, too.
It's like those two trails we were talking about.
Yeah.
The same destination, but totally different hikers on each path.
Exactly. So now I'm thinking about guides.
Yeah.
And I'm thinking, I'm not so sure that we attract two different types of people. I think that we attract the people who are wanting to actually go out and make a difference in the world and make a difference in their practice. So if you're wanting to learn a technique to actually help your patient, as opposed to learning something just to get the CEUs. So I think from that standpoint, we attract the same type of people. People actually wanting to learn something to actually help in their office.
You've got Dr. Iriarte for MYK and Erik Dalton for Matt, but what about the other instructors?
Yeah, that's a good point. Are they all personally trained by the founders?
So right now, I am the only instructor for the MYK system. I don't have anybody else going out and teaching for me. So every class that you see that's listed, I believe we have 60 online classes, live webinar classes scheduled for next year, for 2025, if you're watching this quickly after we make it. But I'm also scheduling in-person classes at people's clinics and things like that. So I'm the only one that goes out and teaches right now. With Erik, he just started a number of years ago. He started, I think he calls it the Dalton Gang. His name, Erik Dalton. So he calls it the Dalton Gang. And some of those people are now allowed to go out and teach his material as well. So that's a fairly new, I'm going to say within the last maybe 7-8 years or so that he started that program.
Do they just bring a lot of practical experience?
Like, have they actually used these methods in their own practice?
Yeah, it's like choosing a hiking guide, right?
Oh.
You want someone who knows the trail like the back of their hand. Someone who can tell you what to watch out for, help you out when you need it, and share all their knowledge in a way that gets you excited.
Speaking of support, what about the community around each program?
Ooh, yeah, good one.
Do they offer mentoring, maybe online forums to connect with other practitioners? Or more advanced training later on?
Right, because continuing ed, it's not just about learning new techniques.
It's about connecting with other people who are just as passionate about it.
Absolutely.
So we have a Facebook page for the MYK system. We have a Facebook page if you've had a class. It's the MYK students. And then once you take the upper, the lower, and the autonomic nervous system class, you get into the MYK elite area, which is for the certified people to ask about and get different conditions. So those are pretty active sites right now. So that's what we have as far as building a community with the people who have gotten in the class.
Finding your tribe, people who are going to push you and support you as you bring these new approaches into what you do.
All right, so let's switch gears a little bit. Let's talk logistics. Both MYK and AT offer certification paths.
Yeah.
which, that's a big commitment.
Oh, yeah, for sure.
It's not just a weekend workshop. It's really diving deep into their system.
It is. So you really have to ask yourself, do you want to be certified?
Right.
Because it's not just a piece of paper. It's a statement,
Yeah.
It shows you're dedicated to learning these specific methods.
And it can change your practice.
Yeah.
Clients are really starting to look for practitioners with that extra training,
Oh, yeah.
So it can really set you apart.
It's like a badge of honor.
Exactly.
It is with our technique. So we learn the upper and then we learn the lower, and that kind of gets all of the normal conditions that people come in with, plantar fasciitis, headaches, frozen shoulder, that kind of stuff, knee pain, back pain, right? Once you take the autonomic nervous system, that actually, for us, gets into the organs and how to treat the different organs. Sometimes people have an underlying organ issue, but it's not showing up yet. It's not clinical or anything, but it's giving a peripheral nerve symptom. So, for example, somebody could have, I'm just going to throw something out. Somebody could have pain in their hand or whatever, but they have an underlying, issue in their diaphragm and so we can go after that and resolve that. And there's ways to determine, do we need to go after the organ first or do we need to go after the peripheral nerve symptom first? And so that's kind of the things that we learned. Okay,
which brings us to the return on investment.
Okay.
Will these new techniques allow you to offer more specialized services?
Right.
Yes.
Maybe attract
Yes.
new clients?
Yes.
Or even charge more?
Yes.
Or maybe boost your reputation as an expert.
Yes.
Yeah.
Get more referrals.
Yes.
It's an investment in yourself and your clients.
Yes.
It is.
And the future of your practice.
Absolutely. And you know what I'm curious about? How these programs have changed over time.
Oh, that's a great question.
Have they kept up with the research?
Correct.
Right.
Adapted to new trends?
Right, because the world of healthcare is always changing.
Exactly.
We want to make sure we're investing in something that's staying ahead of the game.
It's like choosing a hiking trail that's well maintained.
Yeah.
You want to be on a path that's, both established but also up to date.
So we've covered a lot here.
So before we jump into something new, so the comment that I get a lot from people is they'll take my class and then a lot of people come back and will retake a class. And so in doing that, they come back and say they take the upper body and 3 years later they take the upper body, and 3 years later they come back and take the upper body again. And in that time frame, they'll come to me and say, hey, this is different. You didn't teach this way. And I'm like, oh, well, as I learn things, I make adjustments and I change things and I alter things. And so this is constantly evolving based on the research that I'm doing, the research that is coming out and all of that. So I'm always trying to stay up with what's out there and keep the technique fresh for sure. Okay.
Philosophy, the practical stuff, even what kind of people are drawn to each program.
It's a lot, but it all comes down to a personal choice, really. Which program just feels right for you?
Yeah, for your values, your goals, your style.
Like choosing the perfect hiking boots.
Yeah, the ones that fit you just right and will support you the whole way.
Exactly. And that's what we'll explore in the next part of our deep dive.
Yes.
All those little nuances that can help you make a decision from the heart.
It's all about trusting your gut.
Yeah, listening to that voice inside that says, this is the one for me.
All right, so we've really explored the lay of the land here. We've got our maps, we've talked about the gear. Now it's all about that feeling, the inner compass.
Exactly. Remember all those little cues we talked about, the language, the images, the stories. They all paint a picture, right? Like, what's the heart and soul of each approach?
Okay, yeah. I'm ready to put on my detective hat.
Yeah.
What are we looking for specifically?
We'll start with the tone, right? Like, does MYK really lean into the sciencey stuff? Like, are they throwing research and stats at you to back up their claims?
So someone who's really data-driven would love that.
Exactly. But then
We dabble in that. I don't force it down anybody's throat. A lot of times I just say, hey, here's an article. You can go read it. Here's some information. You can go look at this. So, but I try and keep it more on the focus of the class is more on what do you have to know to determine what's wrong with someone and what do you have to know to then fix that problem. And so that's kind of how I focus and gear the class. I figure all the other stuff that we have in our material and that I talk about, you can go read about on your own if you're interested in doing that. But you don't necessarily have to have that detailed information or that research article in order to fix the person that's sitting in front of you. So I do try and bring the whole scope of the whole body and the whole person into play so that we can fix whatever they're coming in with. Okay.
Maybe using language that's more, I don't know, inspiring, like about how their techniques can help clients heal themselves, move better, all that.
So they're speaking to a different part of you.
Yeah.
Okay.
Like it's about connecting with a deeper philosophy.
Okay, now what about the testimonials? Like on each website, are they highlighting concrete results like less pain, better movement? Or are they talking about more like subjective stuff, like feeling better overall?
Yeah, those can tell you a lot about what people are getting out of it, right? Like who's drawn to each approach.
It's like getting a sneak peek into their practice, seeing how it works in real life.
Exactly. Oh, and don't forget the visuals. Look at the photos and videos they use.
Okay, so MYK, their website has a lot of those clean, almost medical looking images, diagrams, pictures of people doing specific techniques. It's very professional.
Very structured, yeah.
Well, thank you.
It goes back to that precision they're all about.
Albert and Irene, they're pretty good folk. I kind of like them. So, all right, that was a nice compliment on the website. It looks clean. It looks, professional. I like that. Okay.
Their website's more, I don't know, expressive, more about that connection between the practitioner and the client.
Yeah, maybe showing clients moving freely, smiling like they're feeling relief.
So it's more about capturing that feeling of healing.
Exactly. And those little differences, they really tell you a lot about what each program values.
I'm getting a much better sense now of how they're different, not just the techniques themselves, but like their whole vibe.
Totally. And you know what? Here's a big question to ask yourself. Think about your ideal client. Like, who are you most passionate about helping?
Yeah.
What kind of change do you want to see in them?
Because that should play a role in your decision.
Absolutely. Like, do you want to work with athletes, helping them perform better, recover from injuries?
Or are you more drawn to people with chronic pain, helping them find relief and improve their quality of life?
Well, I don't think you have to choose. I think you can take either one of these techniques and work on both types of those people. All right, that's just my opinion. Okay.
Yeah, because the program you choose should not only fit your own goals, but it should also give you the tools to help those specific people.
So it's about finding that perfect match, right? Where your skills and your passion line up with what your clients need.
Exactly. It's about building a practice that feels good and that makes a difference.
Well, this deep dive has been amazing. We learned so much about MYK and MAD, the practical stuff, the philosophy, even what kind of people are drawn to each one.
It's been quite a journey.
We explored the terrain, looked at the maps, and really listened to that inner compass.
So now it's about trusting your gut and choosing the path that feels right.
And this is just the start, right? The world of manual therapy is huge.
It is.
There's always something new to learn, new techniques to try out.
So stay curious and keep learning. Your clients and your practice will thank you for it.
Great advice. Thanks for joining us for this deep dive. We'll see you next time.
Very good. All right, I thought that was a pretty good example of the two different techniques and what we get. I'm not sure how much Erik teaches anymore. When I talked to him, when I first talked to him back in like 2008, so we're going way back, he told me then that he was kind of going into semi-retirement. He was cutting back on how much he was teaching. So I know he's cut back even more. I've heard he does a few classes a year. And I think that's why he started having other people go out and teach with him. So that's one of the benefits. I will say, separating the two, that's one of the benefits with the MYK system is right now, any class you take, you're going to learn from the person who developed it, which would be me. So, if that interests you, then that would be a class to choose. But we get very good results. He gets very good results. I've heard very good things, about his class and different things. And like I said, I've met him. I've talked to him a number of times, and he's always been super nice to me. And so he's a good guy. I like Erik. So that was a good thing for Technique Talk, the MYK system, and more. And stay tuned. We got more good episodes coming up. And if you made it this far, smile.